Is it okay if I come in?
Yes.
Hello, how are
Hi.
you?
Good, how are you?
Good. My name's Sophie. I'm going to be your student nurse today.
Okay.
Can I have you confirm your name and date of birth for me?
Lauren Schilling, November 19th, 2002.
Okay, awesome. Let me check that on your wristband. Okay, let me double check it in the chart. I see that in your chart. And then do you have any allergies?
No.
No allergies. Okay, let me confirm that in your chart. Okay, good. I see no allergies in your chart. And then what brings you in today?
I hurt my wrist, my right wrist.
Your right wrist. Okay. And then when did you hurt your wrist?
I hurt it yesterday while skateboarding.
Okay, yesterday while skateboarding. And then what does your wrist feel like? What's the pain feel like?
It's a dull ache.
A dull ache. Okay. And then does it radiate anywhere?
No, it just stays on my wrist.
Okay. And then on a scale from like 0 to 10, 0 no pain, 10 the worst pain of your life, what would you rate the pain?
I probably rated about a 7.
About a 7. And then is that a tolerable pain for you? No. Okay. What would be a good pain?
Like
tolerable pain?
Maybe 3.
A 3. Okay.
Yeah.
All right. We'll try to get it down there for you. All right. Awesome. And then has it changed at all from yesterday to today?
No.
No. Okay. Perfect. So what we're going to do today is a head-to-toe assessment. It will take like 15 minutes. And if you have any pain or anything during the assessment, just let me know. We could stop, take breaks, all of that. Okay. So I'm going to start with some questions first.
Okay.
So who are you?
Lauren Schilling.
Okay. And then what's the next upcoming holiday?
Valentine's Day.
Okay. And then who's the current president?
Trump.
Okay. And where are you right now?
Concordia Hospital.
Okay, perfect. So your ANO times 4, no speech or movement abnormalities. And what does your diet look like?
It's a lot of veggies, carbs, fruit, some dairy.
Okay, sounds like you get like a good mix of everything.
Oh, protein.
Okay, and protein. Okay, good. And then what about your water intake? How much water would you say
I
you drink
drink
a day?
about 8 cups.
Okay, that's great. We recommend 8 cups usually. And then do you like the taste of water?
Yes.
Okay, awesome. If you didn't like the taste of water, there's other things you could do to flavor it to make it taste better. But I'm glad to hear that you like the water. So next I'm going to start off with checking your scalp.
Okay.
Okay, no signs of hair loss or skin breakdown. No signs of pressure ulcers. I'm going to check behind your ears. All right, skin looks intact. Skin looks intact behind this ear. And then do you wear any hearing aids?
No.
No hearing aids, okay. Let me also check for any cerebrum in the ears. I don't see any cerebrum in your ears. None in that ear. Okay, great. I'm gonna check your temporal pulses now, okay? Okay, pulses are equal, bilateral, 2+, and regular, so that's all normal. And I'm also gonna check your coccyx for any pressure ulcer signs. Okay, good, I don't see any. Okay, next what we're gonna do is test your 6 cardinal fields of gaze.
Okay.
So I'm just gonna have you keep your head stable and then just follow the pen light with your eyes. Okay, ready? Okay, 6 cardinal fields of gaze, like normal. Now I'm gonna check your pupils. So just look kind of right past my head, just straight in front of you. All right. Okay, pupils are 3 millimeters. They're reactive to light and accommodating, and they are equal in size. So that's good. And now I'm going to check your conjunctiva. Okay, pink and moist, and sclera looks white, no signs of jaundice. Would you mind opening up your mouth for me? All All right, oral mucosa is pink and moist, and thank you for sticking out your tongue. No signs of thrush on the tongue. Let me check your nose as well. No signs of polyps. Okay, no skin breakdown on top of the nose. Okay, good. Now I'm going to have you swallow for me. Okay, great. No signs of tracheal deviation. I'm gonna check your carotid pulse.
Sorry,
You're good.
it's a bit ticklish.
Okay.
Okay.
Okay, carotid pulses are equal to plus and regular, so that's great. Now what I'm gonna do is, well, actually I'm gonna tell you about your vitals that I just saw on your chart. So your temperature is 98.8, so that's a very normal temperature. Blood pressure is 120/82, so that's perfect. Now what I'm going to do is test listen to your lung sounds, okay?
Yes.
You're a giggly patient.
I know, this is okay.
You're fine.
Okay.
Okay.
Are you listening to the front or back? Sorry, I moved my hair.
Oh, we're gonna do your front first. Okay. So every time I put my stethoscope down, just take a deep breath in for me, okay?
Yes.
Okay. 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 And one more on this side. Okay, good. I'm gonna check this side. Okay, one more. All right, the front lung sounds are clear for auscultation, sound normal. So now I'm gonna check the back.
Okay.
And same thing, just take a deep breath.
Okay.
Okay, clear for auscultation. Breath sounds normal.
Okay.
No crackling, no wheezing. So that's great. And then, would you mind putting your arms out for me like
Yes.
this? Okay. Do you feel this equally on both sides?
Yes.
Okay, perfect. And then I'm gonna have you lift up. Okay, no signs of skin breakdown on your elbows. I'm gonna also listen to your brachial and radial pulses. So, go right here. Okay, equal bilateral, 2 plus and regular. Let me go underneath here. Thank you. Thank you. Okay, equal bilateral, 2 plus and regular. And now I'm gonna check your capillary refill on your fingers.
Okay.
Okay, less than 3 seconds. All right, less than 3 seconds in those digits, so that's normal. Next, I'm going to have you lay back for me.
Okay.
You need any help laying back? Okay. I'm gonna bring this up for you here. Okay. So do you have to go to the restroom at all? Because I'm gonna be pressing a little bit on your stomach. Okay. Also, when was your last bowel movement?
Earlier today.
Earlier today. Okay, and then how frequently would you say you have a bowel movement?
I would say about 1 to 2 times a day.
1 to 2 times a day.
Yeah.
Okay, all right, that sounds normal. And then what does it look like?
It's brown and soft.
Brown and soft. Okay, perfect. While you're laying down, I'm gonna check for any signs of dehydration as well. Check your charger. Okay, great. No signs of dehydration. Okay, now I'm gonna listen to your bowel sounds and then we're going to palpate.
Okay.
All right, great. Bowel sounds are present. Okay, now I'm gonna palpate. I'm gonna go softer, and then we're gonna do a deeper palpation next. Okay, let me know if anything hurts or you feel any tenderness. Good?
Yeah.
Okay, we're gonna go a little deeper.
Okay.
Okay, no bulging.
Okay.
I didn't feel any like distended organs. Now I'm gonna press on your bladder. Okay, no urinary distension. So that's good, normal. Now I'm gonna check your apical pulse.
Okay.
Okay. Okay. Your pulse is about 82 beats per minute, and your respiratory rate was 18. So that's all within normal limits as well. Okay, now I'm gonna test I'm gonna have you sit back up for me.
Okay.
And thank you. I'm gonna test your range of motion on your upper extremities.
Okay.
So I'm gonna have you put your arms out like this, and then forward, up, and then do a circle backwards and a circle forwards. Okay, perfect. And then I'm gonna have you press down on my hands like a gas pedal.
Okay.
Great. And then resist my hands.
Okay.
Okay, and then squeeze my fingers. Okay, great. So you get a 5 out of 5 on your range of motion and your strength in your upper extremities. So that's good. And now I'm gonna check your popliteal pulses. So if you don't mind scooting back for me. Perfect. Okay, so those are a little bit weak. Now we're gonna check your posterior tibial pulse. Okay, good. And now I'm gonna check your dorsalis pedis pulse. Oh, you have strong pulses on this one. Okay, and let me check your capillary refill down here. All right, capillary refill is less than 3 seconds. Okay, less than 3 seconds on both. Okay, you can sit back up for me. I'm gonna change my gloves.
Okay.
Okay. Didn't see any signs of edema on your feet either, so that's good. Okay. Oops. All right, and then I also wanted to ask you too, do you wear any dentures or have any missing teeth from when I checked? Okay, great. Okay, so next I'm gonna have you stand up for me. Okay, so what I'm gonna have you do is walk to the door and back. Okay, your gait is steady, and no signs of your gait is steady and you don't have any signs of pain. So now I'm gonna have you mirror me. So
Okay.
what I'm gonna have you do is take your left leg and go up straight and then back and then down, and then your right leg straight and back and down. Okay, well your strength, you got a 5 out of 5 on your lower extremities and your range of motion, so that's great. And I think that will conclude our head-to-toe assessment. Do you have any questions for me?
No, I don't.
No questions for me? Okay, so it looks like the doctor prescribed you 400 milligrams of ibuprofen for your pain.
Okay.
So we're just gonna have you rest and then come back in 2 weeks so we can check on that for you, okay?
Perfect.
Okay,
Sounds great.
Awesome. All right, well, have a great rest of your day.
Thank you. You too.
Thank you.
All my supplies are already on this table. Hi, my name is Maria and I'm going to be your student nurse today. Today we're going to be doing an abdomen and neurological assessment. So first we're going to start off with abdomen. So for that I'm going to have you lay down please and lift your shirt up just a little bit. Okay, and pull down your shorts just a tiny bit. Okay. So first we're going to start off by inspecting your abdomen. I see that your abdomen is flat. I see some breathing and slight vascular movement, so that's pretty normal. Your skin tone is appropriate for ethnicity. I don't see any lesions, any stretch marks. I don't see any piercings. I don't see any lumps or visible masses, so that's good. Everything looks good there. So now we're going to be auscultating for bowel sounds. Okay, so I'm going to be auscultating your abdomen. Okay. And this is going to be just a little bit cold, okay? And while I'm at it, I'm just going to be auscultating your aorta for brewery, okay? Okay, and I'm just going to be auscultating for brewery and your renal iliac. Okay, so there were bowel sounds present in all four quarters, and I didn't hear any brewery in your aortic or renal iliac. So everything sounds good there. So now what we're going to be doing is we're going to be percussing your abdomen, okay? And then we're going to be checking for splenic dullness, and then we're going to be checking for liver span, okay? So first we're going to start off with general tympany. So I'm just going to be checking for tympanic sounds. Okay, so I heard tympanic sounds all around. I'm just going to be checking for splenic dullness. Okay, so your spleen sounds dull, so that means that's good. So now we're going to be checking for your liver span. So first I have to locate your liver. Okay, so I'm just going to put a little marker right there. And then we're going to be looking for a resonant sound. Okay, so put another little marker right there. And now we're just going to be checking your liver span in centimeters, and it should be around 6, 7, around that area, okay? So it's right at 6 centimeters, so that's normal. Okay. So next we're going to be doing palpitations. We're going to be doing light and deep palpitations. And then we're going to be palpating for your liver, your spleen, and we're going to be checking for tenderness in your CVA, okay? So first, we're just going to be lightly palpating. Let me know if you feel any discomfort, any pain. No pain, no tenderness?
No.
Okay, now we're going to be doing a little bit deeper. Let me know if you feel any pain, any tenderness. No? Okay, so everything seemed good there. I didn't feel any palpable masses or anything abnormal. So now we're just going to be palpating for your liver, okay? I mean your spleen. Okay, your spleen is not palpable, so that's normal. And now we're going to be palpating for your liver. So for this, I'm going to have you take a deep breath in and then breathe out for me. Okay, breathe in for me. Okay, so you can feel just a part of your liver, which is normal. Okay, so now you can put your shirt down, and we're going to be checking for CVA tenderness, okay? So you can sit up for me, and then face the camera, face your back to the camera. Okay, and I'm going to have you pull your shirt up just a little bit, and I'm going to set my hand. My hands are a little bit cold, and I want you to let me know if you feel any tenderness when I hit my hand, okay?
No. No.
Okay. So that completes your abdomen assessment. Now we're going to be moving to your neurological assessment. So for this, I'm going to have you turn your body towards, yes. Okay, so first we're going to be checking if all of your cranial nerves are intact. We're going to be checking for your olfactory, optic, ocular motor, trigeminal, acoustic, your glossopharyngeal and vagus, your spinal, your hypoglossal, and that's it, I think. Okay, so first we're going to be testing your olfactory nerve, and for this I'm going to have you close your eyes, and I'm going to have you close one nostril, and I'm going to be putting scents to your nose, and I want you to tell me what they are, okay? So this is the first one. Take a deep breath in.
Vapor rub.
And close the other nostril. And take a deep breath in.
Candle.
Okay. Okay, so that nerve is intact. So now we're going to be checking your other nerves, okay? So for this, I'm going to have you follow the pen, okay?
Okay.
Okay. Okay. So now I'm gonna shine a light in your eyes to check for pupillary response, okay? And you can just look straight for me. Okay, so pupils are parallel, they're round, responsive, and everything. So now we're gonna be checking your facial. So I'm gonna have you smile and frown, and then I'll have you lift up and down your eyebrows. Have you blow up your cheeks and resist against my hands. Okay. So now I'm going to be doing a whisper test. So I'm going to whisper something in your ear, and I want you to tell me what I say. Okay.
1, 2, 3. ABC.
Okay. So now we're going to be checking your other nerve. So I want you to resist against my hands and lift up your shoulders. Okay. Turn your head, resist. Turn your head. Okay. So and now we're going to be checking your mouth. Can you please open your mouth? Okay, since we're not performing a gag test, I'm just going to look. Okay, your uvula is midline. Can I have you move your tongue side to side and up and down? Okay, and then I'm going to have you repeat after me. Tight, light, dynamite.
Tight, light, dynamite.
Tight, light, dynamite.
Tight, light, dynamite.
Okay, good. So all of your cranial nerves are intact. And now we're going to be checking for cerebellar function. So for this, I'm just going to be testing your gait. So I want you to stand up and walk to the camera. And then back. So normal gait, no abnormalities with that. So now we're going to be doing a tandem walk. So I want you to walk heel to toe to the camera. And back. Okay, then I'm going to be testing the Romberg gait. So I'm going to have you stand there with your eyes closed. I'm going to have my hands in front and behind you to just make sure you don't get dizzy or anything. Okay, there's some slight swaying, which is normal. Okay, so now I want you to touch all of your fingers. Okay, so now I want you to touch your nose and then touch my finger every time I move it, okay? Okay, so now we're going to be doing heel to toe, heel to shin, my bad. So I want you to run your heel down your shin. Same thing on the other side, okay? So all of your cerebellar functions are intact. So now we're going to just be checking for spinothalamic tract, okay? So for this, we're just going to be checking pain. And I'm going to be touching you with light and dull objects, and with your eyes closed, I want you to let me know if you feel a sharp or dull object, okay? So if I could have you close your eyes. Sharp, dull, dull, sharp, dull, dull, sharp, sharp, dull, dull, sharp, dull, sharp, sharp. Okay. So now I'm just going to be checking for light touch, and I want you to let me know when you feel it, okay? Feel it, feel it, feel it, feel it, feel it, feel it. Okay. Okay, so now we're just going to be checking for position. So for this, I'm going to have you hold your hands out, and I want you to close your eyes, and as I move your fingers, I want you to let me know if I move them up or down, okay? Up, up, down, down, up, down, 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 up. Okay, so now we're going to be doing the same thing on your feet and your toes. Down, 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 up, 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 down, up, up. Okay. So your positioning is intact. Everything looks normal. So now we're going to be checking for tactile discrimination. And with that, we're going to be doing two tests. We're going to be doing the stereogenesis and the graphesthesia test. So for the first one, I'm going to be putting objects in your hand with your eyes closed. I want you to tell me what the object is, okay? So close your eyes for me. Okay, let me know what this object is. Ring. Okay, and this one? Paper clip. Okay. Okay, so now I'm going to be drawing things on your hands, and this is the graphogenesis test. So for this one, I'm going to be doing a number. Let me know what number it is. 1. Okay, and for this one, it's going to be a letter, okay? M. Okay, great. Everything looks good there. So now we're going to be doing deep tendon reflexes. So for this, when I pull your limbs, I want you to just be dead weight, okay? And with this, I'm just going to be doing examples. I'm not actually going to hit her with this. Okay, so just dead weight for me, and then just tap right there. And I'm going to be pressing down on the tendon, tap, tap, and then the same thing on the other side. Dead weight, tap, turn, tap, tap. And then we're going to be doing the same things we're going to be doing the deep tendon reflex test on your biceps, triceps, brachioradialis, your quadriceps, your Achilles, and then we're going to be doing a plantar test, and then we're going to be checking for quadratus, okay? So we're just going to be doing this on your Achilles, tap, tap, and then we're going to be checking for quadratus. Okay, nothing there. So now I'm going to have you lay down, please. And we're just going to be checking your plantar reflexes. Okay. Okay, toes curled, so that's good. So, and that completes your neurological assessment. Thank you so much for participating.